Ketamine was initially developed as an anesthetic in the 1950s, and it's been used in emergency departments and ORs for 50, 60 years, now 70 years even. But in the late 90s, early 2000s, there was some basic research that suggested ketamine would be effective as an antidepressant. And from there, scientists studied in both animals and then humans the antidepressant effect of ketamine and found it to be really effective as an antidepressant. One of the unique aspects of ketamine is that it acts really rapidly, especially for suicidal ideation. It happens in a matter of hours. But what's nice about ketamine relative to other antidepressants is it allows you to see a response within a few weeks, as opposed to 6 weeks of a trial and then sort of coming off of the medication and letting the weaning process happen. Ketamine really works quickly, and so you have a sense of if this is going to be beneficial for you really early on in your treatment. And so ketamine is a unique molecule. It acts on the NMDA receptor in the brain, which is part of the glutamate system. And so it's not related to the serotonin system or dopamine, like a lot of other antidepressants are. And so ketamine has really, called into question the serotonin hypothesis of depression. And, one of the big research questions now is, how does ketamine really work? And, I guess even as an extension of that, how does depression really work in the brain? And so here at Alleviation Ketamine, we have a few ideas about that, and it's really integral to our approach here. So when you go into a ketamine infusion, it induces an altered state of consciousness, or what we would call a non-ordinary state of consciousness. And when that happens, what happens with ketamine in particular is it decreases the activity of a set of regions of the brain known as the default mode network. And that part of your brain, or that network in your brain, is responsible for creating the sense of self, the sense of who we are in the world, the sense of us being a unique entity in the universe. And so it helps us define sort of our boundaries, our sense of who we are and what it means to be us at a deep level. And when ketamine deactivates that area, it really allows you to see yourself in a new light, and allows you to take a new perspective on yourself and who you are and how you fit within the grander scheme of things. And that allows you to create change and to see how you could be different in the world. And in a lot of ways, that is a really powerful experience that allows you to continue to make change and to find what you really want out of life. Also, what happens is that area of the brain is deactivated. The parts of the brain that do come to the surface are unconscious processes that we're often not used to communicating with. And so those parts of your brain and your nervous system will speak to you in a different language. And part of our role here is to help you translate that and make sense of what that part of your brain and nervous system is trying to communicate. And so those regions of your brain communicate using visual metaphors, using sensations in the body and somatic feelings, or emotional states. And so when those things come up in an infusion, we can work with you to help you process that. And we do that by first setting an intention at the beginning of every infusion, so that you have a sense of where you want your mind to take you. And then afterwards, we'll break down everything that came up and help you make sense of it, so that you can then integrate it into your regular life moving forward. So that's kind of one part of how ketamine works. The other way that ketamine works is by inducing or impacting neuroplasticity. It boosts neuroplasticity, and that is the way that the brain creates connections and creates new pathways within the brain and the nervous system. And so a lot of our sort of habits or thought patterns are created by networks in the brain that are fairly hardwired. And over time, those repeated patterns have created a real kind of like a deep rut that we keep going into constantly over and over again. Ketamine allows that to change and allows you to make new pathways and see and respond to things in a different way. And we support that process by adding meditations, by adding exercises, by doing group therapy and meetings, where you can really learn how to sort of shape your nervous system in the way you want it to go, and to respond and act in the world the way you want. And so we'll support you through that whole process. And so combining, both the ketamine infusions and the natural effects of ketamine with, counseling, with exercises, with integration support, we can really help you sort of rewire the brain in the way that works best for you and what you want out of life. And that's how we approach ketamine here at Alleviation Ketamine.